Hi and welcome back to another video of Medic Notes. This video is on pyogenic flexor tenosynovitis. Pyogenic flexor tenosynovitis is an infection of the synovial sheath that surrounds the flexor tendon. Diagnosis is made clinically with the presence of the four Kanavel signs. Treatment is urgent irrigation and debridement of the flexor tendon sheath with IV antibiotics. For its incidence, it occurs in 2.5 to 9.4% of all hand infections. Risk factors are diabetes, IV drug use, and immunocompromised patients. The causes are penetrating trauma to the tendon sheath, direct spread from nearby areas, or infection travels in the synovial sheath that surrounds the flexor tendon. The most common organism is Staph aureus. Others include MRSA in IV drug users, other common skin flora like Staph epidermidis, beta-hemolytic Streptococcus, Pseudomonas aeruginosa. Mixed flora and gram-negative organisms can be seen in immunocompromised patients. Eikenella in human bites, and Pasteurella multicida in animal bites. For anatomy of tendon sheaths' function is to protect and nourish the tendons. Variations of tendon sheaths are common. They can extend from index, middle, and ring fingers, from dip to just proximal to A1 pulley. Thumb's flexor pollicis longus sheath, from IP joint to as proximal as radial bursa in wrist. And the little finger, from dip joint to as proximal as ulnar bursa in wrist. This picture shows the areas of tendon sheath. Clinical presentation of pyogenic flexor tenosynovitis. Symptoms are pain and swelling. Typically present in delayed fashion over last 24 to 48 hours. Usually localized to palmar aspect of one digit. Physical exam look for the four Kanavel signs, which are flexed posturing of the involved digit, tenderness to palpation over the tendon sheath, marked pain with passive extension of the digit, and fusiform swelling of the digit. Other signs include increased warmth and erythema of the involved digit. For imaging, radiographs usually not required, but may be useful to rule out foreign object. MRI can be done, but cannot distinguish infectious flexor tenosynovitis from inflammatory, but may help determine the extent of the ongoing process. Clinical diagnosis is made with careful history and physical examination by looking for the Kanavel signs. Differentials include felon, cellulitis, deep space infection, and collar button infection. Treatment can be non-operative or operative. Non-operative is rare. Includes hospital admission, IV antibiotics, hand immobilization, and observation. This management can be done if there are signs of improvement within 24 hours, so no surgery is required. Most cases are operative management by doing incision and drainage followed by IV antibiotics. The complications of the condition are stiffness, tendon or pulley rupture, spread of infection, loss of soft tissue, and osteomyelitis. That's all for this video. Thank you.